So this is anteroposterior view of leg, showing the lower end of femur, tibia, fibula, and this is knee joint at the ankle joint. Ankle joint is formed by the tibiofibular mortise. So different parts you will be pointed. You have to identify the parts and related questions will be asked during the hospi. So these are the tibial condyles, femoral condyles. These are intercondylar eminence. Okay. Here is the head of the fibula articulating with the tibia, forming proximal tibiofibular joint. Here is the intermediate tibiofibular joint formed by the interosseous membrane, and here is inferior tibiofibular joint. Okay, that is also a fibrous joint formed by the inferior tibiofibular ligament. And here are the malleolus. Malleolus are frequently asked. So tibial malleolus or medial malleolus. It is fibular malleolus or lateral malleolus. Okay. And this is lateral view. Tibia and fibula are superimposed. That's how you identify the view. Okay. And here also in lateral view, you can see the patella clearly in the knee joint. Okay. And these are the two femoral condyles, two tibial condyles. And here is ankle joint. Here also two malleoli are superimposing along with the talus. Okay. The later anteroposterior view of leg and lower part of the thigh, showing the knee joint and ankle joint. Anteroposterior view, lateral view. Okay. Now this is anteroposterior view of left foot. Okay. Left and right you determine from the written. L is left, R will be right. Okay. So you have to identify the bones. This is lower end of the tibia, medial malleolus, lower end of the fibula, lateral malleolus. Okay. Here the talus and calcaneum is superimposing. So this one is head of talus articulating with the navicular, and this is anterior end of calcaneum articulating with the cuboid. Okay. And these are the cuneiforms, medial, intermediate, lateral cuneiforms, and these are articulating with the 5 metatarsals. From medial to lateral you will count first, second, third, fourth and fifth metatarsal. And below the head of the first metatarsal, these are the two sesamoid bones. Okay. And the head of the metatarsals are articulating with the phalanges. Okay. 2 phalanges for the great toe and 3 each for the rest of the toes. Proximal and distal phalanx for the great toe, proximal, middle and distal phalanx for rest of the toes. And this joint is the midtarsal joint. Okay, inversion and eversion of the foot is occurring at this joint, midtarsal joint, talocalcaneo-navicular joint. Okay, and calcaneo-cuboid joint. These two joints are together form the midtarsal joint, and eversion of foot is occurring at this midtarsal joint. Next, this is lateral view of the left foot. Here you can see this is talus, calcaneum. Okay, this is navicular, cuboid, and 3 cuneiforms are overlapping. This is first, second, third, fourth, and fifth metatarsals, and these are the sesamoid bones below the head of the first metatarsal, and these are phalanges, proximal and distal phalanx for the great toe, proximal, middle, and distal phalanx for the rest of the toes. Okay. And this part of the calcaneum is forming the heel. Okay. Here tendocalcaneus is attaching. Tendocalcaneus is formed by gastrocnemius and soleus. Okay. So this is that will be asked in your OSPI. Related question will be asked. And here lower end of the tibia and lower end of fibula articulating with the talus to form the ankle joint. Okay. So anteroposterior view of the left foot, lateral view of the left foot. Next we are going here. Here also you see this is a X-ray of a patient of female patient 11 years of age. Okay. So the epiphyses are not fusing with the diaphyses. So epiphyseal line you will see here. So this is fibula, laterally lying fibula, upper and lower epiphysis is not fused. This is tibia, upper and lower epiphysis is not fusing with the shaft. And this is the knee joint. Here you can see the epiphysis at lower end of femur is also not fusing. Clear epiphyseal line, black colored line is the epiphyseal line, and this is joint cavity in between the femur and the tibia. This is joint cavity of the knee joint, and here is the ankle joint where it is joining with the talus. Okay. So this is antero-posterior view and this is lateral view. Lateral view are identified by overlapping of the tibia and the fibula. Here also you can see the clear epiphyseal line at the junction between the epiphyses and diaphyses, and you read the time of appearance of the epiphyses and time of joining with the diaphyses. That can be asked in your OSPE. Okay. Okay, here also near the posterior end of calcaneum, you can see another epiphysis is formed, okay, which has not joined with the calcaneum. This is also a X-ray of the foot, epi view and lateral view. Okay, this is also 11-year-old female patient. Here also you can see for these are the lower end of tibia and fibula. Then talus and calcaneum is overlapping, head of the talus articulating with the navicular, anterior end of calcaneum articulating with the cuboid, and these are the cuneiforms, medial, intermediate, lateral, cuneiform. First, second, third, fourth and fifth metatarsals, and see here the epiphyses, these are short long bones. So, one diaphysis, one epiphysis. So, for the lateral 4 metatarsals, the epiphysis is lying near the head of the metatarsal, but for the first metatarsal, epiphysis is lying at the base of the metatarsal. Okay, that is the difference. And for all the phalanx, epiphysis is lying near the base of the phalanx. Okay, so that is the difference. So that's why this first metatarsal can be called modified phalanx. Also in case of hand also, first metacarpal is called modified phalanx. Okay, that can be given in your explain why question. Why it is called modified phalanx. Okay. And this is lateral view. Here also you can see the talus, calcaneum, lower end of tibia and fibula. So this joint, this crossmark area, this has been given in your OSPE. So this joint is the talonavicular joint. Okay, talonavicular, and this joint is the calcaneocuboid joint, and you must have to identify the bones. So talus, calcaneum, navicular, cuboid, and these are the cuneiforms. Okay, and these are the metatarsal, first, second, third, fourth, fifth, and these are the phalanges. Same, the epiphyseal line can be visible in this 11-year-old female patient. And for phalanges, epiphyses are lying near the base of the phalanx, and for the metatarsals, epiphyses are lying near the head of the phalanx. And these tarsal bones are short bones. They are ossifying from single center. Okay. And for this great toe, the metatarsal, epiphysis is lying near the base of the first metatarsal. So in the, you can see the ribs, intercostal spaces. These are lung shadows, and this is shadow of the heart. Okay. So in the midline, this black shadow is shadow of the trachea. Okay. This is right heart border and this is left heart border. So right heart border consists of, from above downward, right brachiocephalic vein, then superior vena cava, right atrium, and here will be the right ventricle, some part. Mainly right atrium, most of the portion is formed by the right atrium, and left heart border is formed by the aortic knuckle. This is aortic knuckle. Then shadow of the pulmonary trunk, then left auricle, small part, and then left ventricle. Okay. And these angles are important. This is cardiophrenic angle. These are the domes of the diaphragm, domes of the diaphragm. So, in between the domes of the diaphragm and cardiac shadow, here will be the cardiophrenic angle, and laterally here is the costophrenic angle. Okay. So, if fluid accumulation occurs in this, generally occurs in this costophrenic angle, and it will obliterate the angle, then it is called the pleural effusion. Okay. And it can occur due to hydrothorax, pyothorax. Mainly in these cases it will be obliterated. Okay. And in pneumothorax there will be widening of the angle. Okay. And these are the bronchovascular markings. Bronchovascular markings are formed due to the branches of the bronchial artery and branches of the pulmonary trunk. They are forming the bronchovascular markings. They are seen in the normal lung shadow, and in case of lung collapse, there will be only blackish shadow only. This bronchovascular shadow will be absent in pneumothorax. Okay, in pneumothorax it will push the lung towards the lung, hilum of the lung, and this on the lateral side where the air is lying, there will be only black shadow, no bronchovascular markings will be visible. Okay. So, that will be the difference. Here also, and another is cardiothoracic ratio, ratio between the widest width of the thorax and width of the cardiac shadow. Okay. It is almost half. If it is occupies more than half of the width of the thorax, then there is increased cardiothoracic ratio, and generally occurs in hypertrophy of the heart, hypertrophy of different ventricles, or pericardial effusion, fluid collection. If fluid collection occurs in the pericardial space between the parietal and visceral layer of the parietal peritoneum, then there will be increased heart shadow, and cardiothoracic ratio will increase. Okay. Here also you can see, and this is the first rib. So, above the first rib will lie the apex of the lung, which is covered by the Simpson's fossa. Okay. So, this will be, and these angles are very frequently given. See, these arrow are showing these angles. Okay. And their clinical aspects and different things will be asked in your OSPE. Here, this arrow is showing the aortic knuckle, and related questions will be asked from there. So, here also you can see the dome of the diaphragm, and below the dome of the diaphragm, sometimes there is collection of air in perforation of the bowel. There will be collection of air below the diaphragm. Okay, and fundic gas shadow is also visible. Okay, so here also you can see these are the lung shadows, heart shadow, right heart border, left heart border, cardiophrenic angles, costophrenic angles, two domes of the diaphragm. So, right border of the heart, cardiophrenic means between the heart and the diaphragm, cardiophrenic here, right cardiophrenic angle, left cardiophrenic angle, right costophrenic angle, left costophrenic angle. Okay, apex of the heart is directed towards the left side. Here right has been written, so this is right side of the patient. So, these are the bronchovascular markings near the hilum of the lung. These are more prominent. Okay. So, this is right heart border formed from above downward by the right brachiocephalic trunk, superior vena cava, right atrium, and part of right ventricle, mainly right atrium most of the part. And here left heart border is formed by the aortic knuckle, pulmonary trunk, left auricle, and left ventricle. Okay. And this is shadow of the trachea. And these midline structures, these are the spines of the thoracic vertebra. Here is the cervical vertebra, and where it is joining with the first rib, from here is the thoracic vertebra. Okay. and in between the vertebral bodies, the black area, these are the intervertebral discs. Okay, intervertebral disc. This is also can be given intervertebral disc and related question. It is formed by which structure, development, all this can be given in your OSPE. Okay. Okay, and also you have to note down any fracture or anything soft tissue shadows if present, abnormal presence, you have to note down. So this is clavicle. Here is the shadow of the scapula. This is the glenoid cavity articulating with head of the humerus forming the shoulder joints. Okay, and this is inferior angle of the scapula. Okay, this is acromion process forming acromioclavicular joint. Here is the sternoclavicular joint. Okay. Okay, so that's all. Any queries? কোনটা বল? Left border is formed by from above downward by this aortic knuckle. Here is the pulmonary trunk. Just below it, here is the left auricle, and here is the left ventricle. Okay, understand? এটা spine of scapula. Spine of scapula. এটা আর এটা spine of scapula. Here is the acromion process. It a spinary continuation. This is superior border mainly. This is superior border, and this self-like projection is the spine. আর এটা হচ্ছে crest of the spine. আর here is the acromion process. Okay. এখানেও same হবে. This is superior border mainly. Superior border. Here is the medial border, lateral border, inferior angle. And this is the spine. Here it is continuing as the acromion process. Okay, where it is joining with the lateral end of the clavicle. Our type of joints of very important. Acromioclavicular joint, sternoclavicular joint. Okay, others joint দেখা যাবে in foot also. Different joints, type of joints are important.